Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Nefazodone. Its brand name is Serzone. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if any time during this video you find this information to be valuable, please consider leaving a like on the video as it would really help me with the YouTube algorithm. So first, what will we cover in this presentation? We'll start by talking about how Nefazodone works. We'll then discuss indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Nefazodone. We'll then discuss examples of dosing, and then stick around to the end where we'll talk about side effects with percentages. So how does Nefazodone work? Well, Nefazodone is classified as an antidepressant. It is derived from phenylpiperazine and has a mechanism of action that is not completely understood. However, it's thought that its mechanism of action is due to its ability to inhibit neuronal uptake of serotonin and norepinephrine. In terms of indications or reasons we would prescribe this medication to a patient, we often see this medication used in major depressive disorder, or MDD. With respect to contraindications or reasons we would not be able to prescribe Nefazodone, we wouldn't give this medication to a patient who had a hypersensitivity to Nefazodone or any other component of the formulation. This medication should not be co-administered with triazolam, and we also wouldn't give this medication to a patient who had previous liver injury with Nefazodone. Now what about dosing with Nefazodone? So in the treatment of major depressive disorder, or MDD, the initial dose would typically be 100 milligrams orally twice daily. The patient would have the option to increase the dose by 100 or 200 milligrams per day in weekly intervals, and the maximum dose would be 600 milligrams per day. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Nefazodone, so I'll go over some of those here now. Orthostatic hypotension, or a sudden drop in blood pressure when going from a seated to a standing position, may happen 3 to 4% of the time. 10 to 17% of patients may experience constipation, while 14 to 23% may experience nausea. Xerostomia, or dry mouth, may happen 25% of the time, and asthenia, or abnormal weakness, may happen 7 to 13% of the time. 7% of patients may experience confusion, and 11 to 22% may experience dizziness. A headache seems to happen in 26 to 52% of patients. Lightheadedness may happen 10% of the time, and 16 to 32% of patients may experience somnolence. 3 to 9% of patients may experience blurred vision. Now, some more rare but serious side effects would be serotonin syndrome, angioedema, or suicidal thoughts. That's all we're going to talk about today with Nefazodone or Serzone. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.